Aaron.
Well, hello, Filipinars listeners and followers. I hope you are all well. This is a special edition of Filipinars due to the importance of our topic today. And as you know, Filipinars is a public service project of the PNANV, or the Philippine Nurses Association of Nevada, in collaboration with PHLV Radio. So thank you for joining us today. So just recently, we had the NNA, or the Nevada Nurses Association, here at our program to talk about the NLC, which is the Nurse Licensure Compact for Nevada. The NLC simplifies the process for nurses to provide care across state lines, enhancing workforce mobility and flexibility in healthcare delivery. So today we are continuing that discussion, and we will be talking about a specific bill, a Senate bill, which is SB 34, which we as nurses will hopefully will help pass the NLC. I have invited a co-host with me today for our program, and this is Ms. Deborah Collins. Welcome, Deborah.
Thank you, Doris.
Deborah is the chairman of the Nevada Action Coalition, which I also try to support. And Deborah, can you tell us a little bit about you and the NAC?
Sure. I am a registered nurse and have lived here in Nevada for the past 24 years now. And the Nevada Action Coalition began in 2009. First, we had to obtain a coalition status. Took us a couple of times. We're part of the Future of Nursing, Robert Wood Johnson's foundation, and we have accomplished many programs within Nevada as far as nurse residency program, making sure that our nurses are baccalaureate prepared. Recently, we have joined the National Forum for Workforce Centers, and so Nevada Action Coalition in the state of Nevada now is part of the forum.
Awesome.
And so we are excited about working on workforce issues.
Very good, very good. And you always have my support, you know that. So thank you, Deborah. We also have two very important people who are joining us today via Zoom, since they are not here in Las Vegas. Let us welcome Mr. Joseph Filippi and Ms. Kathy Denauer. Welcome.
Thank you.
Thank you. Happy to be here.
Thank you again. Joseph Filippi was appointed by Governor Joe Lombardo to be the executive director of the Patient Protection Commission. Joseph most recently served in the Director's Office of the Department of Health and Human Services during the COVID-19 pandemic, and he served as the Executive Assistant for the Division of Public and Behavioral Health, which he provided strategic oversight and support to several boards and commissions, and were tasked with protecting and improving the health and safety of Nevadans. Previously, he has also worked for the workforce program as a manager for Nevada Rural Hospital Partners, where he was responsible for implementing the Nevada Nurse Apprentice Program statewide. And most recently, he has authored the SB 34, our topic of discussion for today. So thanks for joining us, Joseph. And do you have anything to add to that?
No, Doris, thank you so much for that introduction. I appreciate you sharing my background, and happy to be here and be part of the discussion. I would appreciate your interest in both the Patient Protection Commission and the bill one of the three bills they're proposing this legislative session, Senate Bill 34, which, as you mentioned, includes that Nurse Licensure Compact.
Very good, very good.
Next, we have Kathy Denauer. Kathy is the Executive Director of the Nevada State Board of Nursing. In her role, she has overall responsibility for the regulatory agency's daily operations, which certifies approximately 65,000 RNs, licensed practical nurses, and certified nursing assistants, and APRN in Nevada. Before her role as the executive director, Ms. Denauer was a chief nursing officer at a 200-bed facility in Nevada. She has over 40 years of experience as a registered nurse in education, emergency nursing, and leadership.
Okay, so Kathy, do you have anything to add to that? Welcome.
Oh, thank you so much for that lovely introduction. No, I'm happy to be here. I'm always happy to speak about support for the Nurse Licensure Compact and happy to work with my colleague, Joseph. So we are very, very grateful for this opportunity.
Well, thank you. Let's get the questions rolling, and let's start with Joseph. Mr. Felipe, can you tell us about the Patient Protection Commission of the Governor's Office? What is the commission's purpose and goals?
And Doris, thanks for the question. So a little bit of background on the Patient Protection Commission. It's a policy board that's located within the Nevada Department of Health and Human Services. The specific duties and authority given to it is outlined in Nevada Revised Statute Chapter 439, but overall, the main purpose of the commission is to systematically review issues related to healthcare access, quality, and affordability. And so the commission was originally created in the 2019 legislative session through Senate Bill 544. And then 2 years later, during the next legislative session in 2021, it was actually moved from under the governor's office at the time to then under the director's office of the Nevada Department of Health and Human Services, which is where I work currently. And so the reason that it was moved to the Department of Health and Human Services, really, it was to better support Nevada patients, giving the commission more access to the data of the department and also the other resources the department has. And then in addition to reviewing issues related to healthcare in the state, they're then also responsible for submitting a report to the governor and the legislature every 6 months, so two times a year, with recommendations on how to address identified issues. And I did also want to note that, one of the reasons why we're here today, the commission is authorized to submit up to 3 bill draft requests for each legislative session. They have submitted 3 bills for this 2025 legislature to consider. Those include Senate Bill 29, Senate Bill 34, which we're going to talk more about today, and then also Senate Bill 40. So just wanted to share a little bit of background on why they're allowed to submit those bill drafts.
Very good. Well, thank you for that. I'm not sure what Bill 29 and Senate Bill 40 is, but I'm sure we can find that out. Do you want to give a little gist?
Sure,
on
I
that?
can give you a little bit of information. So Senate Bill 29, primarily it does a couple things. It would authorize Nevada Medicaid to establish what's known as accountable care organizations, or ACOs. What those are, it's basically a coordinated team of healthcare providers that really they're, as you might be aware, Nevada Medicaid primarily pays providers through fee-for-service activities. So basically, it really rewards for the volume of healthcare services versus the quality of healthcare services. And so by establishing these accountable care organizations, the intent is to incentivize more providers and hospitals and health systems to work collaboratively together, coordinate services, really with a goal to increase quality of care, but also address the cost of healthcare as well. And then that same bill, Senate Bill 29 still, it also is recommending a Medicaid rate increase for physicians and advanced practice registered nurses. And so that's the main goals of that bill. Senate Bill 40, it's also related to Medicaid. What it would do is establish a healthcare workforce account. So basically a bank account, so to speak, within Nevada Medicaid, that any funding that the state allocates to that account, the Medicaid office department would then be authorized to draw down additional federal funds, because if you don't know already, really how Medicaid works is it's a state and federal program. And so really for every dollar that Medicaid spends, Nevada pays 40 cents and the federal government pays approximately 60 cents. And so really the goal of this account would be to maximize any state dollars that we allocate towards healthcare workforce and draw down additional federal dollars to really increase the impact of those dollars and address the workforce challenges our state faces.
Well, I'm glad that those bills are up there because I predominantly work in the home health area. And one of the biggest challenges we have is to cover the care for people in the rural areas. So I applaud you for that. So thank you. Okay. So how many members does the Patient Protection Commission have, and what areas of expertise do these members have?
So the Patient Protection Commission has 12 voting members. They come from different backgrounds within the healthcare spectrum. We have patient advocates, providers of healthcare, which include, we have some physicians, we have nurses, we have pharmacists, and then we also have other health industry professionals who work in, the health insurance section of our state. And then additionally, we have 4 non-voting members, and those are actually representatives from state agencies that have oversight over healthcare in the state. Those include the director of the Department of Health and Human Services, the insurance commissioner at the Nevada Division of Insurance, the executive officer, I believe, over Public Employee Benefits Program, and also the executive officer over the Silver State Health Insurance Exchange. And those are really members that support the other voting commission members and bring their expertise and information from their various departments.
Okay, great. That's good. But what is your duty specifically as the executive director of the PPC?
It's a great question. So my main role, so in statute, it states that I'm responsible for performing the administrative functions of the commission and other duties as assigned from the commission. And so ultimately what that entails is, supporting the commission to fulfill their duties outlined in statute. If you ever get an opportunity, or if you're kind of a nerd like me that likes to look through bills and statutes, our statute is pretty lengthy. It gives the commission a lot of different areas to focus on. And so really my role is to help them identify areas of focus and conduct that systematic review of healthcare issues in the state. In addition, I help facilitate their public meetings, and then also coordinate with other entities such as yourselves who are working in the healthcare space, and really anyone who's studying or addressing the healthcare issues in our state, I'm supposed to be coordinating and collaborating with. In addition, I help the commission submit their reports that are due every 6 months, and of course help them with the bill draft request submission process and presentations as well.
Very good. Speaking of bill drafting, you authored Senate Bill 34, which recommends the revision of the provisions relating to certain providers of healthcare, more specifically advocating for licensure compact. Can you tell us about SB 34 and which healthcare professions are requested to have the licensure revisions?
Absolutely. So the bill is rather lengthy, I will say. It's over 100 pages long, but really what it does is it enacts multiple interstate licensure compacts, 5 to be specific. Those 5 interstate licensure compacts include the Nurse Licensure Compact, the Physical Therapy Compact, the Audiology and Speech Language Pathology Compact, and also the Occupational Therapy and Physician Assistant Compact. Right. And so really when the commission was reviewing issues related to healthcare within this last year, they were really focusing on the healthcare workforce needs of the state. And a little bit of background on why, I just want to say, is Governor Lombardo issued an executive order last year that specifically requested the commission provide recommendations on how to improve healthcare access and also remove unnecessary state administrative hurdles that might impact recruitment and retention of healthcare providers. And then additionally, the governor has what's called a 3-year policy plan. Really, every governor of Nevada has created this, where it's their policy priorities that they would like other state agencies to accomplish while they're governor. And so within that policy plan, he has a goal that states that he would like to simplify professional licensing and reduce barriers to entry. And so in response to these goals, the commission submitted Senate Bill 34, which, as you mentioned, it simplifies the licensure process for healthcare providers, it lessens administrative burden for them, it addresses the workforce challenges that we face, and it improves the efficiency and accessibility of healthcare services. That's really the main goal of this bill. And so also, joining compacts I will say it does increase the state's access to additional healthcare providers, because really it's allowing providers from surrounding states and other states across the nation to work, be more mobile, to cross state lines without having to apply for an additional license. And so it allows these providers to have more mobility and increases access to care, telehealth services. And it also benefits, as you mentioned, the rural and underserved areas of the state. Many of our the areas of our state, as you know, are rural and frontier. Often that these towns are bordering other states, and maybe, for instance, Elko. I know that a lot of residents in Elko. I was, for a little bit of background, I was grew up in Elko, moved to Carson City when I was a teenager, but. So I know that a lot of people in Elko, they travel to Salt Lake City across the border in Utah for a lot of healthcare services. So this would allow nurses who live in Utah or other states to cross, maybe go into Elko to provide services, and just ultimately increasing access to care statewide.
Right. One of the biggest challenges that I've seen too is over in the Laughlin, Bullhead City area, wherein Arizona is a compact licensure state. Well, Nevada is not. And so the caregivers who are like maybe one house down the road from a patient cannot give them their care because of the licensure challenge. So thank you for that. Do you have any statistics in the Nevada provider ranking nationally in relation to healthcare professions included in the SB 34?
Yes, thank you for asking, and that's something that the Commission reviewed prior to submitting this bill for consideration. They were really looking at, out of all the various healthcare professions in the state, where do we rank compared to other state national averages? And unfortunately, this might be no new news to you all, but Nevada continues to rank well below the national average in many healthcare professions per capita. And so specifically to the five, professions that are outlined in the Senate Bill 34, Nevada ranks 35th in the country for occupational therapists, 36th in the country for physician assistants, 45th in the country for registered nurses, 46th in the country for physical therapists, 49th for audiologists, and 50th for speech language pathologists. So as you can see, we rank well below the national average, and shortages in the number of these healthcare professionals definitely can create an environment where the quality of care suffers for Nevada patients.
Absolutely. Those are horrifying statistics, right, Deb?
Especially with our growing people moving here and needing health care. That's daunting. That's outrageous.
And for nursing, 45th in the nation, that's outrageous too.
It is.
And I did also want to say, I'm sorry, I forgot to mention that I spoke with Dr. John Paco. I'm not sure if you're already familiar with him, but he leads the Nevada Healthcare Workforce Research Center at the University of Nevada, Reno, at their School of Medicine. And according to his data, to simply meet national provider ratios, patient to provider ratios, I should say, Nevada would need an additional 4,900 registered nurses and 3,150 licensed practical nurses.
Lord, that has increased. Yeah.
So Kathy, questions for you is it evident that the nursing statistics show that nursing license compact is important for Nevada? And can you give us a history of the quest for getting the Nevada to be an NLC state?
Well, thank you, Deb, for that question. And yes, I believe it is very important for Nevada. We have tried for well over 10 years to get the Nurse Licensure Compact passed in our state. When the compact was first came about at a national level, Nevada did not participate, and that was at the time because there was not a requirement for fingerprints. And that changed, I believe, around 2013, 14, somewhere around there. And there was a new edition of the compact. And since that time, 39 states have entered into the Nurse Licensure Compact in 2 territories. So we are really one of the last states that does not have a compact. And it is, I think it would very much benefit Nevada, as you've already mentioned and has been discussed, as Joseph mentioned, we border several states that do have the compact, especially to the east of us with Arizona, Utah, Colorado, and then to the north we have, up in the states of Wyoming and Idaho. And so that leaves us in the west with Oregon and California not being part of the Nurse Licensure Compact. And when we have nurses working anywhere, but especially in more the rural areas in the border, in the areas bordering other compact states, it does, as Doris mentioned, it does get to be very difficult because the nurses then sometimes can't, they can't treat their patients because they have to have a license in the state where the patient is located. And with the Nurse Licensure Compact, it would allow nurses to function with one license and be able to practice in all the states that are part of the compact.
Yeah. Right.
Thank you, Kathy. Can you tell us the results of the most recent survey conducted by the Nevada State Board of Nursing in regards to the NLC support for nurses, from nurses?
Yeah, I'd be happy to. So we conducted a survey along with, it was actually conducted by the National Council of State Boards of Nursing and with our support. And the survey was conducted in December of 2024. The results came out January of 2025. They had over 12,000 nurses that responded to the survey. And that was about a little over 20% return rate on the response rate on the survey. And in that survey, 95% of the nurses who responded were in favor of the Nurse Licensure Compact. And this is for RNs and LPNs. I'm not talking about APRNs. This is RNs and LPNs only. And so it is overwhelmingly supported by the nurses in Nevada that they want the Nurse Licensure Compact.
And do you have any of the FAQs about the NLC, and what are some of the concerns raised about the NLC?
Yes, well, we have a list of some FAQs on our website. There's actually a section on our website that you can go to that talks about information with regards to the compact, and there's a fact sheet with regards to the survey, and some other FAQs responding to some of the concerns and opposition to the compact. And there are concerns that have been raised over the years. They're the same concerns that are raised every single legislative session. And those concerns raised are issues like that the compact will lower the standard of care within the state. There is no evidence to show that. There's none. And that has to do with a CEU requirement that is not necessarily the same in every state, and some compact states don't have a requirement for continuing education. But there is no evidence to show that the compact will lower the standard of care in the state, because each state that participates in the compact must adhere to 11 uniform licensure requirements. And part of that is that the nurse has to have completed and passed an NCLEX exam, has to have graduated from an accredited nursing program, and there's a whole host of requirements that have to occur before a state can participate in the compact. So there is no evidence to that. There are also concerns with regards to the Nurse Licensure Compact Commission. It is a commission composed of members of each compact state. There are some misconceptions that it is somehow run by this National Council of State Boards of Nursing, which is not correct. The Nurse Licensure Compact Commission is run by those states that are participating in the compact, and each state has an equal vote, and they have a representative from their state that participates on the compact commission, and it's the commission that makes the rules and the laws that go forward for all the compact states. So those are some of the big concerns that we hear about often. But again, as nurses, we tend to be very evidence-based and evidence-driven, and there hasn't been any evidence to show that this will lower any standard of care in the state.
Okay, very good.
So, Kathy, with that being said, with the concerns, where are the concerns coming from?
The concerns are coming from the nursing unions, two unions in particular. They're the ones that are voicing actual concern, providing public comment. I believe that there are documents out there in the internet universe that describe some of their concerns to the compact. We've answered them the best that we can. But they continue to occur, and it's the nursing unions. And when we did this survey, we actually found that one of the questions on the survey is if you are working for an employer or if you were part of a union. And many of the nurses that did answer who are part of a union are in favor of the compact, regardless.
Okay. Well, thank you. Thank you for that clarification. So what is the Nevada State Board of Nursing's role in getting a bill for the NLC passed?
Well, we're doing our very best. As I said, it's been a long road. Those of you know how hard, Deborah, you're laughing because you've been involved in this for many years.
Yes.
And the Board of Nursing and our board has supported and has gotten behind the Nurse Licensure Compact. So I'm not just speaking on behalf of myself. I'm speaking on behalf of our board, who does support the Nurse Licensure Compact. It is a licensure tool. That is what it is. It's not necessarily going to cure the nursing shortage or necessarily be specifically addressing environmental or geographical concerns within a particular organization. It is a licensure tool that nurses have voiced and said that they want in our state. It allows for mobility of that nurse. It's also a cost savings for that nurse because now they don't have to get an individual license in every state that they decide to practice. We have tried in 2023. We thought we would have, we really had a very strong opportunity to get this passed. We had a Democrat Assemblywoman who went before the Assembly, Commerce and Labor, willing to push forward with the compact. We had multiple individuals and organizations speak on behalf and support of the compact, including nurses at the bedside, which is so important. We had representatives from the military that were willing to speak. We've had the Department of Defense speak publicly in support of the Nurse Licensure Compact, and it did not make it. It did not make it out of committee, which was just very, very unfortunate. And so we will keep pushing the fight. I think that it is going to be up to the Board of Nursing to continue pushing that fight. So when the PPC it wanted to introduce the compact, we were certainly very supportive of that and very willing to be there to help support the cause.
Absolutely, absolutely. So thank you for those insights, Kathy. Now these questions are going to be for the both of you, Kathy and Joseph. And you had mentioned about the union. Are there any other major organizations or entities that are in opposition of SB 34 or Licensure Compact? And what are basically the reasons for the opposition? And do you think these reasons are valid?
Well, I'll take a stab at it.
Okay.
So, no, other than the unions that have come forward and actually made public comment in opposition of the compact, there are individual nurses who have voiced opposition to the compact as well. Usually they are a member of a union, and it is for some of the very reasons that I mentioned earlier with lowering the standard. There is a belief that it will lower the standard of nursing care. There's concern for what happens with a nurse who maybe it is being investigated for maybe a violation of the Nurse Practice Act and what's going to happen if that nurse does not have a license in the state. And there's no evidence to necessarily support those concerns with regards to discipline and investigations. It's a tighter structure with the compact, because the compact states all communicate very, very well together. So even if a nurse doesn't hold an actual physical license in the state, they have a privilege to practice,
Right.
And that privilege to practice can be revoked. at any time should there be a violation of the Nurse Practice Act or through due process and all of that. So we haven't been able to find any evidence to support any of the opposition. And Joseph, I'll let you speak if you want to add anything.
Thank you, Kathy. I think you did a great job at summarizing, the union opposition and just opposition that we've received as well at the Patient Protection Commission related to the Nurse Licensure Compact. I will just say also that the unions have argued that ultimately they think the Nurse Licensure Compact could be used as a strike busting measure. And I want to also indicate that according to Kathy's board and the information within their FAQs on their website, you'll see that there's no evidence in Nevada or throughout the nation that any state, any Nurse Licensure Compact has had any it doesn't diminish or impact a union's ability to strike, and there's no language within the bill that would impact Nevada labor laws. So, as Ms. Denauer indicated, all the Nurse Licensure Compact and Compact bills do is allow for licensure mobility. That is the main objective of, and as she said, still ensuring that the quality of care and oversight of the board exists. The Nevada State Board of Nursing would still have the same authority over compact nurses as it does Nevada licensed nurses currently. So that would not change.
I just wanted to mention again that within the 39 states that have become part of the Nurse Licensure Compact, some of those states have heavy union organizations within their states, and they have managed to get those compacts passed. The last state that joined the compact, I believe, is the state of Connecticut, and they were able to successfully get that done. And so we do work with the National Council of State Boards of Nursing and also look at strategies, what other states have done that do have a heavy union opposition or vocal union opposition. So we're very fortunate to have a lot of those resources available to us.
That's great. And, they're already, I don't know, they're already using travel nurses, and I don't know what the difference is if you have a nurse compact licensure rather than hiring a travel nurse, and these pays are expensive, right? Anyway, so what steps can we take to get the SB 34 passed, especially from from the nursing standpoint, and of course the other professions as well?
I'll go ahead and start, Kathy. So I think what you're doing today is a great step. I think, spreading awareness to Nevada nurses throughout the state about just that the bill is being introduced. It includes the Nurse Licensure Compact. As Kathy mentioned, a majority of Nevada nurses are supportive of this. So I think just as far as spreading awareness is helpful. If you or anybody else would like to submit a letter of support or reach out to a legislator in regards to the support of this bill and the Nurse Licensure Compact, anyone can do that. This bill, the Senate bill, would have to first start in the Senate Commerce and Labor Committee. And so I have their email, and so I'll go ahead and say it. It's SENCL, so it's S as in Sam, E Edward, N Nancy, C as in Charlie, L as in Lima, at sen.state.nv.us. Anyone can email that address. It goes straight to the committee, so you can include letters of support for the SB 34 and the Nevada Licensure Compact. And we don't know when this bill is going to be heard at a committee hearing. We haven't heard of when this is going to be scheduled, but when it is scheduled, anyone can attend those committee hearings either in person or via the phone to voice their support of the Nurse Licensure Compact and the bill. So those are some options on how to support this measure.
Is there a mechanism to get that information out as far as when it will be heard in committee so that we can galvanize and get people together to be on the phone or whatever we need to do for that committee? Or is it just best to go to the website?
So yeah, I will notify Kathy, and
Okay.
hopefully we can spread awareness as much as possible whenever we find out when the bill is going to be scheduled. I've asked the committee chair if she can give me as much notice as possible so that I can inform stakeholders. So I'm hoping we have at least a week or two notice, but you never know, unfortunately, with the Nevada legislature, especially as the months go on and we get towards the end of it, things start to move rather quickly. I believe there's a deadline in early April for the bill to be heard, and if it's not heard by that deadline, it ultimately would die. And so hopefully we are going to get a hearing within the next month or so.
Thank you, Joseph. And I know that we do have the letter of support, so we will definitely, we're already sharing that with the nursing
great.
organizations.
Right. We got that, I think, the other day, and so we'll email everybody. I mean, I will anyway.
Oh,
You
I
already
will too.
started it, right?
Yeah, we will.
That's
Absolutely.
great. I have a spreadsheet that I have shared with Joseph. It's been such a pleasure working with him and the PPC. They've done a great job. It takes a lot of courage and bravery to take on a nurse compact, and I really give them a lot of kudos for doing this, and I really they deserve a lot of credit for that. The letter of support is there. If anybody needs a copy, you can send it out to spread it out. I've sent it to the hospital association, and hospitals will get it, and the nursing schools will get it, and or CNA programs even. I will send it out to them as well. So
Great.
we have a pretty large net and a net of resources of people that are just waiting for the letter.
Yes, and we're one of those. I have to disseminate this to the other organizations as well. So, wow, we do have, a big job ahead of us, but hey, we're nurses. We're up for the challenge, right?
Absolutely. Absolutely.
But, well, thank you for your opinions. Is there anything else that you need us to do? You need us to call our legislators, possibly email them, send out a letter of support, and maybe be aware of some talking points to some of our colleagues, right?
Absolutely.
Okay, very good.
Thank you so much. Thank you for the opportunity to speak. The Philippine Nurses is a wonderful nursing organization and really has a great bandwidth. And so this is a really good opportunity for us.
Well, we're hoping, and thank you very much for that. We try our best, and with Deb's help here, we'll get more associations involved with the NAC,
Absolutely.
Teams.
We'll do what we can. We're here.
Very good. We're here.
This is for us.
First letter, Deb. You were the first person I sent a letter to.
Oh my gosh.
We're serious about this.
Yeah, we failed miserably in 2023, and we were there to help cheer on and support, but
Right.
it didn't make it. So, all right. Well, so what is your message to the healthcare community regarding licensure compact privilege and how it can effectively affect healthcare? Let's start with Deb over here.
Well, for me, with looking at our daunting numbers of our healthcare providers and the need of what we need for nurses and OTs and PTs and all of healthcare, this is so important for this to pass, not only for nursing, but for all the compacts. If, we're last just about in everything for our state. And with the growing population here in Nevada, we really have to be mindful of that. And so I will do whatever personally I can in the Nevada Action Coalition, Future of Nursing campaign. I've got colleagues from the National Forum for Workforce Centers, talking to them as well, because some of the states are going through the same challenges, and using whatever we can use to gain information. So I'm in it for the fight, and it's important. One thing that I will say is that unions need to come to the table. They need to come talk to us, and let's see if we can come together to work out the differences so that we can move this forward.
I'm trying to get them. So we'll see, and we will definitely share this podcast to everyone, every nursing colleague that we know. Kathy, do you have any message?
Well, Deborah is a hard act to follow. I'm not sure I can necessarily add anything. I would echo what she said. I just want, people to remember that the compact is something that the nurses want in our state. It is a licensure tool. It will help nurses in their mobility, and we need to keep that and remind ourselves of that. It's something good, and it's something good for the nurses in Nevada.
Good, very good. And Joseph, you have the last word.
Thank you so much. I just think it's important to note I know we're focusing on the Nurse Licensure Compact today, but, really interstate licensure compacts, they're not new to Nevada. Nevada's enacted several bills in the past that's established interstate compacts. Specifically, we're currently in compacts related to emergency medical services, massage therapists, physician compact, teachers compact, a psychology compact, and these compacts have proven to be beneficial to the state. As we've talked about today, they expedite the licensing process for health professionals. They help attract new talent to the state, and ultimately they increase access to care for Nevada patients. Mm-hmm. And so I just also want to say that in reviewing other bills that have been introduced to the session so far, there are several other compact bills out there in addition to our Senate Bill 34. And these compact bills include, they would support licensure mobility for school psychologists, counselors, dentists, and dental hygienists, and social workers. So I think this shows that other lawmakers are introducing similar bills. And so that to me, that shows that there is support for compacts generally in our state, not only from obviously the providers, but also from lawmakers. And so however we can best communicate that to the Senate Commerce and Labor Committee, indicating that, the Nurse Licensure Compact is no different than all of these other compacts that we've either joined or potentially are going to join. I think that would be a good message to share.
Mm-hmm. Well, thank you for that. And I honestly am hoping and praying actually that with you combining those 5 different professions in healthcare in this SB 34 for licensure compact, I'm hoping that it will actually be heard and be passed this time. So crossing your fingers.
Absolutely. No, that is it. I believe we're good.
All right. Well, thank you so much, Mr. Joseph Philippi and Ms. Kathy Denauer, for joining us today to explain to us about SB 34, Nurse Licensure Compact, and the importance of Licensure Compact, for giving us, and thanks for giving us suggestions on how we can get this important bill passed. And of course, thank you to Deb Collins here for joining us as a co-host and giving us the more insights on this very important topic. And to our listeners and followers, we have to leave you with this. SB 34 is an act relating to healthcare. It outlines entering into interstate compacts that authorize the multi-state practice of certain providers of healthcare under certain conditions, providing professionals practicing in this state under those compacts with the same legal status as persons who are licensed to practice in the same professions in the state. It suggests authorizing the sharing of certain information with data systems created by those compacts. The physician's assistants, the audiologists, nurses, physical therapists, and occupational therapists are the professions that are listed in this bill. But specifically for nurses, NLC is important because it increases the access to care by allowing nurses to practice seamlessly in other NLC states without obtaining additional licenses. NLC maintains high standards of care and facilitates communication between member states. It fosters greater nurse mobility and provides healthcare employers with a larger pool of qualified nursing candidates or professionals. So please call your legislators and let them know of your approval for or your support for the NLC for our state. We will be disseminating this information to other nursing organizations about this matter. And on the same token, we are challenging and we are inviting any organization who has opposing views about the NLC to come to the program or come talk to us. We would love to hear what you have to say. So thank you very much for joining us today. Be safe and be well. Until next time, this is Doris Bauer, your Philippine Nurse host, signing off for now.